Hi, my name is Dr. Sanchia Gunawardena. I have 846 publications and 13 books. And today I'm going to be doing a little bit of relatable content for patients. So if you've ever been diagnosed with a diagnosis of prostate cancer, there are different types of prostate cancer, and today I'm just going to be going over the types of treatment we use for low-risk prostate cancer. So if you've got low-risk prostate cancer, you may be told that you can have active surveillance. Now what this is actually watching out to see if prostate cancer changes and becomes more aggressive in its nature. And this will have PSA checks every 3 months or so, and then having a repeat biopsy normally at the 18-month, 2-year point, and then having biopsies 2 yearly thereafter. And it's what we call active surveillance because we're watching out to see if anything changes with the prostate cancer stage or grade. And it's a very nice way for people to avoid the risks of radical therapies like radical surgery or radical radiotherapy, to avoid the side effects of problems by monitoring your PSA level and by checking the biopsies of the prostate. Now, in a case of cancer, you might ask, well, why do we do this? And the reason is that actually the side effects of those treatments are quite severe, and there are a number of people who wish to avoid those treatments, especially in a type of cancer which, compared to other cancers, if, for example, gastric cancer is like a tiger, prostate cancer is like the kitten. So it's a type of cancer which is very slow growing and indolent in comparison to other cancers. So this is one of the options which is really important. Another option which may be offered for low risk prostate cancer is brachytherapy, and this is actually implantation of seeds into the prostate so that by radiotherapy the prostate cancer is cured. Now, we only offer it for low risk disease, so you may have heard of Gleason scoring. Low risk Gleason scoring would be things like Gleason 3+3, which is just a grade we give the cancer, or Gleason 3+4, and this is what brachytherapy would be used for. That involves planting seeds into the prostate. It's normally done under general anaesthetic, and you can get side effects like blood in the sperm. You can get a bit of irritation, discomfort. You can go into retention afterwards, requiring a catheter. You may have symptoms of going off and going quickly, bit of irritative symptoms, bit of irritative discomfort. The side effects of things like incontinence, which you get with the more radical therapies, you don't have that with brachytherapy, so that's one of the options we use. Or if you're in the older population, you may be told about watchful waiting, which is watching and keeping an eye on your PSA, and then, for example, starting hormone therapy when your PSA gets higher. And the purpose of this hormone therapy is actually to freeze the prostate gland.